Hello and welcome to today's Here's to Your Health podcast. I'm Don Litzman, your host. My guest on the podcast today is Patrick Stevens. Patrick is the Director of Cardiopulmonary Services at CCMH. And Patrick, thank you for joining me today.
Well, it's nice to be here today.
You know, it seems like there's a recognition day or a week for just about everything, or an awareness day or week for just about everything, especially when it comes to healthcare. And chronic obstructive pulmonary disease is no different. And for those people who've never heard of this before, it's not really a laughing matter, to be honest, but for those people who've never heard of this before, that's actually COPD. And most people would know it by its initials rather than by the full name of the disease. Having said all of that and putting all of that aside, to one side for just a second, I think it's important for people to understand what COPD is, because there's an awful lot of people like me. I don't suffer from it. I think I've known some people who have, but it's a very specific disease, and it's going to come with its own symptoms and so on and so forth. We're going to talk about that. But Patrick, just to help everybody understand what it is that we're actually talking about today, can you tell us what chronic obstructive pulmonary disease, or COPD, is?
Well, COPD is a title of a group of diseases. So it's any lung disease that makes it difficult for you to exhale. That's where the obstructive part comes from in the name. Your lungs are obstructed and you can't blow your air out like you should. The chronic part is defined as having symptoms 3 consecutive months in 2 consecutive years. So in order to classify your illness as COPD, you have to meet the chronic part. So it has to be at least 2 years that you've been having issues during 3 months of the year that you can't get your air out as well as you should.
So other than the symptoms that have to do with being able to exhale appropriately, what other kinds of symptoms do you get with COPD?
Well, what I usually tell people when they're wondering if maybe they're starting to have symptoms of COPD is look around at other people your age. Are you walking with your best friend who's the same age as you are and you have to stop and rest after a block or whatever? If you can't perform up to the same ability as someone your own age and relatively same health status, you might want to check into having the doctor see if maybe you do have COPD or at least maybe some other lung issue.
Well, I think we can maybe narrow it down for people who are listening to the podcast today. What are the risk factors? Because just about every disease has risk factors associated with it. What are the risk factors for contracting COPD?
Well, the biggest one, of course, is smoking, but the ones that people don't think about and are actually very common here in Iowa because the agriculture that goes on here is being exposed to the farm chemicals in grain dust. And if you are a chicken farmer, any bird, really, even pigeon keepers can have lung issues if you don't take proper precautions. Farm chemicals are a big one too. So,
our guest on the podcast today is Patrick Stevens. Patrick is the Director of Cardiopulmonary Services at CCMH, and we're talking about chronic obstructive pulmonary disease, or COPD, because this is COPD Awareness Month. And we've talked about, how's it diagnosed, the risk factors. And I think we talked a little bit about symptoms. I think maybe the question that we come to now, you talked about smoking and potentially, farming being an issue, but if you've not done any of those things, can you get COPD if you've never been exposed in that way?
In rare cases, there is a few patients that I've seen that have COPD and we don't find a link. I have had a case where I've had siblings, never been exposed to the known risk factors, and they are investigating to see if there are some degree of heredity. But generally, you're going to fall into one of the major categories. Most common is smoking or farm exposures. So
it's good to know, though, that genetics, by and large, don't really play a role in contracting COPD. That's a good thing to know. So is COPD the same as emphysema? The reason I asked that question is because when I was a kid, there were a couple of people that, and my dad was a smoker for years, but there were a couple of people that he knew who had also been smokers, and they were on oxygen. This would have been back in the 1960s. Mm-hmm. So this is, I hate to say it, it's about 70 years ago. Sad to say, but it is not 70, but 50 years ago. Is COPD like emphysema? Or are they the same, or are they different? And if they are, what does that look like?
I mentioned earlier that COPD was a classification of lung diseases. Emphysema is one of those diseases in the COPD classification. The two other real common ones are chronic bronchitis. We've already mentioned emphysema. And then there's something called bronchiectasis, which you can have a degree of any of those all at the same time. I said 3, but sometimes now they're kind of putting asthma in there. Sometimes they don't. That's kind of a shift we're seeing right now.
And that was going to be my next question. It has to do with what would the difference be between COPD and asthma? Because I have some friends who have asthma who, again, they're mature adults, and they're on oxygen a lot of the time as well, but they don't have COPD. They have asthma.
Yeah, asthma is a reversible condition. We can treat it with bronchodilators, steroids, good hydration to keep the mucus out. It's reversible, and it can come and go. A lot of times asthmatics will have problems in the spring when the pollen comes out. Sometimes they'll have problems in the fall with the harvest, with all of the dust from the harvest being in the air. It depends on what your trigger is. Sometimes it can be exercise-induced. If you have real sensitive asthma, exercise-induced asthma is hard for athletes. But one thing to keep in mind is we've had some gold medal athletes that were asthmatics. So you can live a normal life with being an asthmatic.
We want to thank everybody who's listening to the podcast today, the Here's to Your Health podcast. I'm Don Lintzman, your host. My guest today is Patrick Stevens. Patrick is the Director of Cardiopulmonary Services here at CCMH. We're talking about COPD. Patrick, what are some of the best treatment options for COPD?
Well, basically, the most common one you're going to see are different types of inhalers, and then there's nebulizer treatments. Those are the two big ones you're going to see out in the community, and making sure you avoid your triggers. Like if you're someone who enjoys sports and you have some exercise-induced asthma, use your inhaler before you start whatever sport it is you're going to perform in or participate in. And if you're on inhalers and they're ordered every so many hours, make sure you keep your meds on time, especially if you have a steroid medication, because they need to be, even if you're not feeling like you're having any breathing problems, you need to maintain your steroid level in your system so you stay breathing well.
I don't know that there are people who are always looking for more holistic solutions to these sorts of medical problems. Are you aware of any natural remedies for COPD?
As far as natural remedies, I am not really aware of anything that that a naturopath would use for COPD. But if you want to take that approach, staying as good a physical condition as you can, having a regular exercise routine, having a healthy diet, making sure you get plenty of fresh fruits and vegetables in proper proportions. A lot of times if people have COPD, they'll keep a little, like a apple or cut up fruit or something near so they can snack if they want to, have it all prepared so it's easy to get, because a lot of times people will grab the chips because, well, I don't want to cut up an apple right now, or I don't want to clean my celery or whatever.
Right.
So if you keep things prepared ahead, that makes it easier to maintain a healthy diet. but an exercise routine is very important to keep moving as much as you can.
And maybe the first thing is to quit smoking.
Well, yes, that's a given.
That would be the most natural remedy that you could get to. If somebody is experiencing symptoms of COPD and haven't been diagnosed, we talked about this a little bit earlier, for those people, what's the next step? I mean, so you're feeling short of breath, it happens repeatedly. What do you do now?
At that point, you need to get in and see your physician so he can do some testing and actually determine if you have COPD and how severe it is if it does come back positive. And based on the testing, they will start a plan of treatment. It can be anything from some meds to take. Or sometimes they start off with just as needed medications depending on severity. You might end up with an inhaler every 4 hours, and you might also end up with pulmonary rehab if you're severe enough.
So let's add one more question to our podcast today, and that's this. Just so that people understand what that testing encompasses, I know that you work with COPD patients a fair amount. I mean, these are not invasive tests, but they are tests that are being done all the time, every day, and it's actually pretty easy. So why don't we just talk about the testing side of this for a second, so that people who are thinking about this today have some real insight into what goes on when you get to that testing portion.
As far as the testing portion, when I explain it, it sounds very easy, but if you're truly having breathing issues, it's hard. The one test we call spirometry is a big deep breath in and blast it out as hard as you can. Well, someone who can't blow their air out very well, that blasting it out is kind of hard. We have a couple other tests that we do pretty routinely as well. One measures how well oxygen diffuses from your lungs into your bloodstream, and that involves a 10-second breath hold, which, again, if you're having trouble breathing, that might not be as easy as it sounds. And then the third test really, I think, is the easiest one to physically perform, but it requires some pretty close timing, so I have to coach pretty closely on exactly how to do it, because we have to time breaths with what the machine's doing. So you can come in and get a complete PFT in about an hour to an hour and a half, just depending on how easily it goes and how much difficulty you're having breathing.
Yeah. So if anybody who's listening to the podcast today is experiencing some of the symptoms that we've talked about today, we'd encourage them to contact their medical provider. If you don't have one, you can contact us at the CCMH Medical Clinic at 712-265-2700, or you can go online to request an appointment at ccmhia.com, and we will make sure that you have an opportunity to see someone and take that next step in determining whether or not you do have COPD. My guest on the podcast today, Patrick Stevens, Director of Cardiopulmonary Services here at CCMH. And Patrick, thank you for your time today. I appreciate it very much.
It was nice being here.
Yeah, we thank everyone who's listening to the podcast today. I'm Don Lintzman, your host. Have a great day.